Bismillahirrahmanirrahim. This video is about the brief introduction and the guidelines of the Medical Council of Canada qualifying exam, and this is MCCQE1 exam, and it's basically this guidelines and these slides focuses on the instructions for international medical graduates. This MCCQE1 is a one-day computer-based online multiple choice question exams, and it consists of 230 MCQs. It's basically the first step for applying for the licensure or medical license when you're coming to the Canada as an international medical graduates and you are trying to practice your profession here. So you need to pass this exam in order to get your license. There are more exams like NAC OSCE as well, but this is the first step, and I am making a series on the guidelines of this exam, what to do, what to not to do, and the brief overview about this exam as well as the various topic guideline topics would be updated or uploaded, and you'll get a lot to know about this exam. So it's, as I've previously told, it's a Medical Council of Canada qualifying exam, and it focuses mainly on the medical knowledge and clinical knowledge, I should say, your professional behavior, what is expected of you as a medical practitioner, as a registered medical practitioner, or as a family physician when you are trying to practice this profession. It mainly focuses on clinical decision making scenarios, and it is taken or written all over Canada or all over the world at various prometric centers, as well as through remote proctoring by Canadian medical graduates and international medical graduates as well. So I would be using the imgs for international medical graduates, and I mainly focuses on them as there are very few guidelines are available about this exam, and there are a few differences about this exam. So I want to make some things clear, or that differentiates this exams from other licensing exams like USMLE, that is conducted for United States medical licensing exam. So as the name indicate, it mainly focuses on the Canadian healthcare guidelines, and it's a one-day exam. The whole duration or the time constraint that is available for it is 6.5 hours or 6.5 hours. It comprises of 230 MCQs questions that are divided into two sections, each consisting of 115 MCQs, and the time that is provided to solve those exams is, or to solve those MCQs, is 2 hours and 40 minutes. It, as I've previously said, it mainly focuses on your clinical knowledge. So previously it consisted of two parts, multiple choice questions as well as the clinical decision making part. Now the clinical decision making part has been omitted. It was consisted of short answer questions, but now you just have to give a right option answer, and you have to click on that exam because it's a computer based. There are various topics that are consisted, and mainly as you people have completed the bachelor's of medicine and surgery MBBS from your back home country, so it consisted of the final year topics like medicine, pediatrics, surgery, mainly focusing on the large part comprising of the obstetrics, gynecology, psychiatry and ethics. These are the things that differentiate it from the other exams, because it mainly comprises or focuses on the population health, preventive medicine, geriatric medicine, that comprises or that focuses on the elderly population, the ethics part that comprises of the main chunk of this test. So it focuses on the Canadian healthcare context and where you have to start. So there is an official website that's known as the Medical Council of Canada, and they have given on their website various exam objectives. These serve as the main guidelines on which you have to keep on your mind. You can download those objectives from that website, and you can use these objectives to get a basic idea that you have to focus on what topics and how you have to prepare. So these exam objectives will help you a lot while you are doing the preparation of these exam. What are the major guidelines that are available? So firstly, you have to understand the Canadian healthcare system. You will be starting from the MCC objectives that are basically the blueprints. The CDM part is omitted, as I've previously said. Now the test comprises only of the multiple choice questions. You have to start from the Toronto Notes. Toronto Notes is a basic medical dictionary, or it gives the brief overview of the various topics that are going to be tested from you. So you have to take a single book, and you will revise your clinical knowledge or medical knowledge. After that, you will practice some MCQs, and that MCQs would be from the various updated question banks that are available, like Canada Q Bank, ACE Q Bank, and UWord. So as I have previously said, that you will be following Toronto Notes, you will be reading them, and not all topics are need to be read from the Toronto Notes. Firstly, you will get a brief insight about your topic. You are going to revise those topics. After that, you will getting the practice MCQs from the updated Q Banks. And Canada Q Banks is very specific because it tells you more about what are the professional aspects that are kept in mind while you are following medicine profession in Canada. ACE Q Bank is the easiest Q Bank that one can do, and apart from that, you can do the UWord, Step 2 CK. There are various guidelines. So first you have to read the book. After that, you will practice some MCQs, while keeping the MCC objectives in mind. And at the end of your exam preparation session, the time required for the preparation of this exam would be different according to the what is your basic knowledge and at what level you are being. So a time constraint is different for the different students. Minimum time line that is available is, or that you need to prepare for this exam, would be 3 to 6 months, and you'll be starting from MCC objective, Toronto Notes, updated Q Banks. After that, at the end of your exam, you exam preparation session, you will be going to practice this exam, MCC practice exams that are available on the official website, so you can follow them. It mainly focuses on ethical and patient-centered practice or care. There are various dimensions of the care that are being going to be followed. So it's a chart that is available on their official website. It tests you for the various aspect of the medicine, like acute emergency medicine, like various emergency cases are given as abdominal distension for surgery, or for the pediatric medicine like acute epiglottitis or acute asthma exacerbations. They would be given. You would be going to diagnose them. You will be telling the first step management for them. And apart from that, there would be chronic diseases like cancers. You can be asked about them. There are various psychosocial aspects that they are going to judge you on the basis of them. And there are various health promotion and illness prevention. These are the some things like we are very much sure as an IMG, or while practicing medicine, while learning medicine as a medical student, we know a lot about acute diseases, chronic diseases, their assessment, their management. But there are certain things that we need to more focus are the health promotion, illness prevention, various professional behaviors, what are the psychosocial aspect of the medicine. These are going to differentiate you, and they are going to help you a lot while acing this exam or in preparing for these exams. So these are certain things that you have to keep in mind. So what is the conclusion? As I have already told you, we are going to prepare for this exam. We are having a sound medical knowledge. We'll be going to apply reasons. There would be clinical reasoning. There would be certain Canadian healthcare practice guidelines, and we are going to prepare. I am going to conduct a whole lot session, and these are the various slides that are available. Now I'm going to tell something more about this. Is the thing that I have told you about the Medical Council of Canada. They have these table of contents that are available. These are basically MCC objectives, like they are going to ask you about acute abdominal pain. So there are various differentials that are coming into your mind while you are thinking on the lines of acute abdominal pain. Abnormal heart sound, these are given in alphabetical order, and these are various MCC exam objectives that are available on their official website. Now I'm going to discuss about something more about this MCCQE1. It's conducted throughout the year, and there are various exam scheduling that is available on their website. So it's conducted, there are various sessions. It's conducted 4 times a year, and there are sessions like April 9 to May 21. Their dates get on changing. So first you have to apply or register yourself. You have to make your account on physiciansapply.ca. After that, you'll be, when you'll feel ready, you will book this exam on these various dates: April, August, September, October. So this year in exam 2025, this exam criteria, its guidelines, and they have changed a lot, like scoring changes. Previously it was consisting of like 230, and that was the passing score. Now there is the relative grading system that has changed. So the new scoring scale is 300 to 600, and the mean of that is 450. You have to score at least 439, and in order to match into the Canadian residency matching services, or to continue your profession, or to apply for the match comes, you need to score more than 460, at least more than a passing score. Your score should be good enough in order to excel this exam. There are various preparation tips that I have mainly focus on imgs, that we need to focus more on the MCQs, keeping MCC objectives in mind, using updated Q banks, review Toronto notes. So these will be helping you a lot. And one thing that is more challenging about this exam are the time constraints. So you have to follow the certain time limits. There would be average 1 minute and 23 seconds per question. It's a 6.5 hour exam, and you will not know that how this time will pass when you are actually in this exam. So you will be keeping a check, doing time based practice, and using the Q banks, solving them in the time mode will be helping you a lot. Doing the mock exams that simulate the natural exam condition, that will be helping you a lot. So there are various exam day tips as well, like having a proper sleep, as there are the tips for the other exams as well, as it's going to be a long exam. So you should have a plenty of adequate sleep, and arrive early at the test center, because they will be checking you. They will be doing your ID check as well, and use your 45 minutes break wisely. For the two sections, you should be really careful, because time usually runs, and you should stay focused and calm. So MCCQE1 is a really difficult, challenging exam, and you must be really confident and do a focused practice and preparation, being consistent for 3 to 6 months. That will be going to help you a lot. So this was the brief overview about MCCQE1 exam. I'm going to deliver more lectures about how to ace this exam, what things are going to help you as well. Thank you.